So the question is microdosing marijuana safe, and is there any science to back up the health claims? We're about to talk about just that. Ozzy is the founder of the cannabis publication OOV Lifestyle, and we also have joining us via Skype cannabis Dr. Dustin Sulak. And I want to start with you, Ozzy. Because this whole concept is so new, did you find your appropriate microdose, so to speak, with a doctor? How did you go about that?
A lot of learning the correct dose for yourself is with trial and error, but I would just say to go slow and gradually increase to whatever feels comfortable for you.
Dr. Sulak, are there any conditions or medications that people take that absolutely should not consider doing this, that would make it quite risky or dangerous for them?
There's really not. There are definitely some medications that have interactions with cannabis, but if you're taking a consistent, very low dosage of cannabis each day, you're not going to see any of those interactions. I've never seen that in my practice. A good example is Coumadin or warfarin, the blood thinner. And just like we tell people with Coumadin, eat the same amount of greens every day, it would be the same thing with cannabis. Take the same low dose of cannabis every day. Don't alter it very much. So this is extremely safe. It's non-rewarding, meaning there's no pro-addictive effect. Even people that have a history of addiction don't get into trouble with microdosing because it doesn't send that pleasure signal. It just gives a sense of resilience.
Who's a good candidate?
Well, I think that anyone's a good candidate for microdosing. The concept with microdosing is generally for healthy people that are using cannabis to stay healthy and to improve their resilience to stress. So we have a lot of psychological stressors in our environment, and then we also have toxic stressors and physiologic stressors. We know that our bodies are making cannabinoids, the compounds found in cannabis. We make a very similar analog in our inner pharmacy for the purpose of responding to stress, responding to injury and illness, and keeping us healthy. So this is like a daily supplement, a multivitamin approach to working with a system that's already serving this purpose and just making that system function even better.
And I want to just ask this question because when I first read about microdosing, I thought, okay, maybe we're onto something here. But I also want to play devil's advocate, which is with the general lack of formal research out there, when we throw out terms like health promotion and health benefits, I do think we need to be a little bit careful. I want to ask you as a physician, purely from the science-backed perspective, not just your experience, I mean, how far away are we from having more formal information? Because it is a little bit of a gunslinger approach right now. And in our show, we always say, look, if you're going to try something that's alternative, number one, make sure it's not going to do any harm. And don't always believe anything that says it's just going to cause health promotion for the sake of it. And that's always my concern right now, is it's the new frontier, but scientifically, where are we?
Well, there's no guarantee that this is going to promote health, but if it's reducing stress and enhancing performance, then in my opinion, that's a marker of improving health. The hypothesis, based on lots of animal research, is that cannabis can protect our brain, protect our organs, reduce obesity, reduce diabetes, keep us in a state of balanced health. That's the hypothesis from the animal data. The human data is starting to support that, and there's nothing in the human data that is opposed to this theory.
But no microdosing during pregnancy, though, right?
No microdosing during pregnancy.
Okay.
Yeah, we know that actually there are studies that taking maybe not microdoses, but higher doses can definitely affect the brain development of the baby in utero. So it's definitely not recommended during
Yeah, I would say stay away from, yeah, absolutely. Low birth weight, behavioral problems, brain development, and things like that. So I just wanted to make sure that any viewers watching, if you're pregnant and you're having a little anxiety or you're saying you just want to relax a little bit, I don't think that this is the best option for you, because we don't have studies to support it is safe for your baby.
Doctor, do you microdose yourself?
I do. I've explored it. I've tried microdosing myself using various parts of the plant, THC, CBD, some of the acidic cannabinoids. I find that I'm able to be very productive at work, and I do feel an increased sense of resilience and an increased productivity, more mental clarity, more sharpness, and less stress.
There's so much more yet to learn. And again, as marijuana is being legalized in more and more states, some for recreational use, I think the important thing here is to educate yourself. And if you're considering microdosing, I actually highly recommend you talk with a physician who is well versed in this, because the one fear I have when things are the Wild West is often people think, hey, the more the merrier. And I think we just need to be smart here, but I certainly am happy Ozzy seemed to be having a great result, and glad there are doctors like Dr. Sulak out there who are really pioneers in learning all the new data. So thank you all so much for being with us.